Right, we're on to our first interview of the day right here on Southbeat, and it's about a brand new mental health crisis respite care home, which is opening its doors in Dunedin today. And on the line now is Thomas Cardy. Hi there, Thomas. Thanks for talking with us.
Hi, good afternoon.
Hello there. So can you tell us a little bit about, firstly, why there's a need for this centre and what it actually does?
Okay, so it's really an alternative to an admission into hospital. So people present to the GP or to the emergency psych services when they're having a mental health episode. And historically, people would have been either admitted into hospital if they met the threshold or would have been sent back home if they didn't. And there was nothing, I guess, in between for caring for people in the community which need short-term support. Okay,
so it's like they're not seriously unwell, but it's somewhere where they can be assessed and monitored. Is that right? Where patients.
That's
right.
That's right. So we'll have up to five. We call them clients. 5 clients at any one time, and the home will be staffed with a mix of support workers and registered nurses. So the nurses will work in partnership with the clinical services from Health New Zealand, and we'll monitor the people accessing the service, and there's also follow-up from case managers and so on.
Okay. One thing I liked about this is that there is space for family to visit, see their loved ones, and they can be with them privately, or they could even stay overnight. I think this is such a great idea.
Yeah, that's right. So the home has 5 bedrooms, and then there's a garage attached to it that we've converted into a sleepover room with a bit of a bed and a kitchenette, and people can come and stay. And if the loved one there, it could be family, it could be friends, whoever's important to that person that wants to be close by for the night.
Yeah, because often this isn't the case, and look, I mean, everyone knows that in times of crisis, family is everything, really, isn't it?
Oh, absolutely. I mean, it's really important to be able to keep connected with your family or your important person that's going to help you with that recovery, especially when you go home. Like, keeping that link right through from where you get the support you need to when you go home is really important.
Mm. Now, so this significantly boosts Dunedin's mental health capacity, doesn't it?
That's right. So there used to be provision for one bed across Dunedin, which we used to provide as well. It was quite a different model. It was part of a bigger service that we run. It was very much of an add-on type setup, and there was no clinical staff. So it's quite a shift in terms of capacity, in terms of numbers, but also the capacity of the service to provide clinical oversight and support.
Mm. Okay, so could this save lives in a way? Do you think? If someone is really like suicidal, or I mean, it's not the ambulance at the bottom of a cliff scenario, is it?
No, it's not. It's much more trying to attend and support people earlier when they need that support, because historically by the time you end up in an inpatient service in the hospital, you have to be pretty unwell, and quite often people might present multiple times before that happens. So that's an opportunity to intervene before that point and to provide the support that's required.
Mm. How long could someone stay in the care home?
It's flexible. There is no set time frames. We've got another one of those homes in the lower Hutt area, and I mean, people stay 3, 5, 7 days. It's not a long-term service.
Okay. How's the lower Hutt one been going?
It's been going for about a couple of years now. It's been going good. It's exactly the same model. It's slightly bigger, there's 6 beds there, but it's been going just as good.
Mm. Do you think Dunedin is one of the places that has keenly felt a lack of perhaps mental health support? I don't mean to denigrate the city, but there are, certain areas of Dunedin, lower socioeconomic, where people are struggling and, they perhaps have ill health, and then the pressures of the last couple of years. I mean, we all know how ridiculous it is to just live these days, the cost of living. So are you finding that Dunedin is perhaps worse hit than perhaps maybe other areas? Do you feel that?
I don't think it is. Look, I think if New Zealand gets it right, I think we'll get to a place where there is this kind of support in every main centres around the country. There is some of it in other regions. There is some in Christchurch. There's some in Auckland that I know about. And so I think it's just developing, albeit a bit slowly, if you want to know what I think. But I don't know that Dunedin is any better or worse than any other part of the country.
Probably not, I guess. I'm just curious to know, what your experience has been and, the type of cases you've come across. Do you feel... Do you feel that it is things are improving, like because we're getting these initiatives happening, do you think that we're finally starting to wake up to addressing the problem of our poor mental health in this country?
I think the political will is there. I think it's slow to change. It's a big system with a lot of moving parts, and you've got a bit of two schools of thoughts. You've got the medical model that's really driven through, psychiatrists and doctors. And then you've got another model that's more looking at the whole socio-economics of people's need. And it's more looking at everything from housing to, being employed, being able to make a living. So it sort of ties into the wider well-being. And I think that's where New Zealand's starting to see the benefits of having good mental health.
Yeah, and if mental health is good, the community functions well, everything works better, doesn't it?
It does, yeah, absolutely does.
So if someone wanted to find out more about this, what's the best way for them to do that? Perhaps someone is listening and they are concerned for a family member or whatever. How do they get in touch? Will they go to their GP or...?
They can go to the GP. They can go to Dunedin Hospital where there is emergency attack services and have a chat with them. If in doubt, they can go on our website, give us a call, and we will probably help them navigate the system because sometimes it can be a bit mind-boggling to know where to go. So I'm happy to do that too.
Okay, so sorry. Someone just talked to me there, and I lost my train of thought. But no, I did catch the gist of that you were just saying that there's various options if they want to investigate this.
Yeah.
Okay,
Yeah.
so this is a step in the transformation of our mental health and addiction system, pretty much, isn't it?
It is. And I mean, we're still dealing with the remnant of activity that was happening under the previous DHB, I suppose, before Health New Zealand was set up. So there is little pockets of activities. And my hope is that as we move towards more of a national system, then we start to have a bit of a benchmark about what's needed in every community in New Zealand. And it might be slightly different depending on where you are. But the core of it is really providing that support, early intervention, closer to home, being able to, access a service that meets your needs at a time that works for you and the people around you.
It's good to know that support's there, hey?
Yeah, it is. I'm really excited about the opening today. It's a really fantastic move. So,
is there a special sort of ceremony or anything for the opening?
Well, there isn't really. We just had to crank on with it. We were going to open yesterday, but that sort of got canned. Did say it wasn't such a good day to open such a service, so that's all happening today. And we've been working on it for a number of months now. And it's open, it's up and running, it's off. So there's no special ceremony as such.
Okay. Now, you're the General Manager of Pact Group. Can you tell me a little bit about what Pact is and how it works as well before we go?
Yeah, sure. So Pact is a charitable trust. We were established a long time ago, back in 1876, I believe. And we support people with mental health challenges, disabilities, alcohol and addiction issues, in all sorts of settings. So could be residential, intensive, sort of one-on-one. It could be we see somebody for a few hours a week in their own home, and everything in between. We provide support to people in prison, mental health support in North Island. Yeah,
fantastic.
In the prison. So it's quite a hot spot for services, but they're all sort of related around disability and mental health, really. And we've got about 450, 500 staff at the moment doing that work.
How many staff?
500.
Oh, that's a lot. Yeah, great.
Yeah.
I didn't know that you've been going so long, since the 1800s. Goodness me.
Yeah, it was, yeah. I understand that the organisation was established by wealthy Dunedin businessmen that wanted to do something because there was no welfare system for the wives and children of men that went either to prison or became unwell. So that's how the whole thing started back in the day.
How fantastic. Well, I'm so glad that it's still going, because so many of these things don't have the legs, do they? And they don't last. So good on you, and congratulations on the opening of the new unit, Thomas. That's fantastic.
Thank you. I appreciate that.
Thank you. Thomas Cardy, the General Manager of Pact Group, about the new mental health respite care home in Dunedin, which opened its doors today, and it's Mental Health Awareness Week, so perfect timing for that.